We have some special guests here in honor of Colon Cancer Awareness Month, which is the month of March. So from the Real Housewives of New Jersey, we have Dolores Catania.
Hi, how are you?
Margaret Josephs.
Hi, Steve.
Hi. This is the real Super Joe Beningo.
Hey, Doc.
And Lexi.
Hi.
Hi, and we have with us one of our gastroenterologists, Dr. Andrew Boxer.
Super
Hi.
doctor.
So, Dr. Boxer, would you like to take this conversation right now?
Of course. So thank you for joining us for March for Colon Cancer Awareness Month. So I know you've all had recent colonoscopies. Would you be able to share kind of your experience, how it went beforehand, any anxiety with it, you felt afterwards?
Sure. So I actually am booking my colonoscopy next because thanks to GANJ, after years of suffering with horrendous symptoms, I was finally diagnosed with SIBO, which is a test that no other doctor had ever suggested, had even, considered to be an issue, and it's been life-changing for me. And at 41, I wouldn't have considered a colonoscopy, but now I know I do need to do one, so I'm booking mine now.
Fantastic.
And Lexi was telling me before that GANJ changed her life.
Completely changed my life. I was suffering with diarrhea, constipation, gas pains that lasted for days. I had done sonograms, all different scans, exams, samples, and no one could diagnose this. And if it wasn't for Dr. Chabra suggesting this breath test, I would never have known I had SIBO.
Of course.
So,
Talking to Mike Joe. Okay. I was like, okay.
this never ends. I swear. I just get told what to do. Okay, so anyway, I had a colonoscopy like 10 or 12 years ago. And I drank the liquids, and I really wasn't too pleased with the whole entire thing. And they found 2 polyps. So I was like, well, 2 polyps, not too bad. And then 5 years went by, and Marge started telling me I have to go again, and I, as a normal guy husband, I ignored Marge. So she kept on it, and finally, I did go again. I went over to GANJ, and instead of taking, which I thought was the horrible, wretched stuff to drink, they gave me 24 pills.
12 pills
12,
and then 12
yeah,
pills.
well, 12.
The prep is much easier.
Yeah, the prep is like nothing. That's half the battle for me. And then I went in.
To Dr. Pavlu.
I went into Dr. Pavlu. He went and laid me down on a table, and the next thing I knew, I woke up and they found 2 more polyps. So it was really, I guess, a really good thing that I did go in and they found it. And other than that, I was given a clean bill of health. And I think that actually everyone has to go. You have to go whatever the time period they say. Like, I didn't do it, but I should have done it.
And it was a great date because we did it together.
We did it together. We held hands all the way into the time we went out. A lot of fun.
And your polyps were benign.
And they were benign. It was a
Yes.
great thing.
Yes.
Now, but if you leave them, right, that's what happens. Like, they can
Yeah.
turn into cancer.
Yes, so that's what a lot of people don't realize. A lot of people don't realize kind of the whole process. What happens is about 50% of people over age 50 have polyps. Polyps are small growths in the colon. If they stay there for years and years and years, this is what grows into colon cancer. So it's very important for us to go and find these. And at that time, we go ahead and remove them. By doing this, it will dramatically reduce your risk of colon cancer. This is the only way to reduce your risk. There's other tests out there like stool tests and virtual scans and things like that. Nothing is going to actually reduce your risk. It might tell you there might be something there or might not be something there, but colonoscopy is the only test out there will actually reduce your risk and kind of prevent cancer. This is a preventative test. There's very, very few things you can do for yourself to actually prevent cancer. Very few healthcare screenings out there. There's mammograms and pap smears for women. For men, there's some checks of the prostate and colonoscopy. For women too, colonoscopy. This is the only screening test out there for men and women which is going to dramatically reduce your risk of colon cancer.
Wow. Well, my experience was so easy, so fabulous. And the truth is, I didn't go till this year when I was 54, which is way overdue. But I was trying to convince Joe to go. So I said, we're going to do it as a date. He and I scheduled our colonoscopies together with Dr. Pablo here at GANJ, and it was just so easy. I don't know what took me so long to do it, and thank God everything was okay. But as Joe said, the prep is now so easy. So everybody's always concerned about the prep. I don't want to drink all that liquid. I don't want to be in the bathroom all day. Well, literally now it's just taking a few pills. It makes it so nice and simple. And literally, it's the best sleep you're ever going to have. And it's going to prevent you from getting cancer. What they say, colon cancer is preventable, treatable, and beatable. This is the only way to really stop from getting cancer. And colon cancer now is happening to much younger people. They've actually changed the guidelines. It used to be get a colonoscopy when you're 50. Now the guidelines are when you're 45. But you're actually never too young to get a colonoscopy, because if you have symptoms, diarrhea, bleeding in the stool, stomach issues, your insurance will cover it. So people are getting diagnosed younger. We don't know why, but it's so important to get a colonoscopy. And I'm just so happy Joe's okay. I'm happy I'm okay, but I want everybody to be okay, because truthfully, you can prevent getting colon cancer. And at GANJ, they make it just so easy. And it's the best sleep of your life, and then you go out and have a fabulous meal. that's
what we did.
That's what we did.
So I want to talk about my experience. First of all, here at GANJ, I know almost all the doctors personally, and they care about their patients so much. Your experience here is nothing but it's patient care, and it is preventable if you catch it early. So in my case, the last time I came, I posted it on my Instagram. As you know, we're on the Housewives. And there were so many people that reached out to me with concerns on, oh, I'm afraid of anesthesia, but I'm bleeding and I'm in pain. And I beg them to come, because this can save your life. And you're in, again, the best of hands. He diagnosed someone at 30 years old last week. It's getting younger. So if you have symptoms, you have to come in. There's nothing to be afraid of. The worst thing is to not do it, because then the treatment, you delay that, and then sometimes it gets a lot worse. You can save your life by coming. It's so simple. I mean, I did the prep. It wasn't a big deal. I did the drink. They did the pills. I wish I did the pills, but you have a choice now. As far as the anesthesia, how long is the procedure? Like,
Could be 20 minutes to 30 minutes.
Yeah, so
it's
20,
so
30
quick.
minutes.
You come in, your insurance covers it. It's up to 45, your insurance will cover it. If you have symptoms or a family history, remember, you can come earlier and they will take you. And the staff, the doctors, everybody is here to help you. You don't want to wait for something for it to be too late. And that can happen if you don't come and get a colonoscopy. So I'm begging everybody, I'm urging you. It's nothing, it's a walk in the park, I promise you. Do it.
And I'd like to add, we have 22 locations at GANJ. We're all over northern New Jersey. We have 37 gastroenterologists, male, female, older, younger. You want it, we have it.
I want to also add that a lot of women that I know have stomach issues, like Lexi, and they've been all over, misdiagnosed. They push them off. They say nothing's wrong. Anybody I've sent here has been diagnosed and treated and very happy. So it is the place to come.
And remember, you know the old saying, here today, gone tomorrow? Well, at GANJ, it's here today, here tomorrow. A simple test can save your life. So thank you all very much for coming. I really, really appreciate taking time out of your days. And we know how busy your days are right now. And we look forward to seeing you on Ranj.